What might be an example of like common things that families may not know about as like this is what is typical or normally expected in a retirement community?
Yeah, and I would say, we always expect some sort of transition for people. Making a move is difficult for anybody at any phase of life. Going to college or moving to a new city is hard, and meeting people, finding the places you like to eat, all of those things that go into our day to day life, they are now having to navigate in a place that they may have not necessarily wanted to be initially. So I think, allowing time for that emotional response. I feel like, a lot of folks have a natural wanting to go home response towards the staff or towards their families. And I think, a lot of the staff is trained to be there and kind of redirect and be there with them emotionally through that. But I think for families to know and recognize that that's normal. And I think too, they may not jump directly into all of the things that you may want them to do in terms of the meals or the activities and whatnot. That may be a little slower, just depending on the person. But I think just giving folks time to really warm up to their new place, where you might see things that are not normal. If you really feel like the staff is not being attentive to your loved one, if you're seeing a lot of hospitalizations, which is something that we are, working with our partners to really understand, where is this happening? Extra hospitalizations, lots of urinary tract infections. If you're seeing, smelling things that would not be ideal, those are all things to pay attention to if you feel like you're seeing any red flags in that regard.